Cervical cancer is the second most frequent type of cancer among all women in Nepal and is sadly also the leading cause of death among women with cancer in Nepal. Against this backdrop, to prevent this fatal disease, the government of Nepal has made the commendable decision to introduce the HPV vaccine as a high priority in the government's policies and programs. The HPV vaccine is not only safe, it is highly effective at preventing HPV and cervical cancer. This plan is in keeping with our regional immunization goal of leaving no one behind and with our WHO Southeast Asia regional roadmap. Our regional roadmap calls for increased investment in the health of women and girls, and I congratulate Nepal for doing just that. With this, Nepal is advancing towards the global target for 2030 of 90% of girls fully vaccinated with the HPV vaccine by the age of 15. It is also, of course, a vital step towards achieving the elimination of cervical cancer. Nepal is also in line with a regional implementation framework for elimination of cervical cancer as a public health problem for 2021-2030. Along with primary prevention through HPV vaccine, this framework also proposes improving screening and pre-cancer treatment, improving access to early diagnosis, treatment of invasive cervical cancer, rehabilitation and palliative care, improving health system support, and strengthening education, advocacy, and social mobilization. It is through these strategic actions that we can eliminate cervical cancer in our region. I am delighted that today, on World Cancer Day, Nepal is launching HPV vaccinations, and I am pleased this has come about with the support of WHO, Gavi, the Vaccine Alliance, UNICEF, and other partners. I am pleased and proud that WHO provided technical support, including to the National Expert Committees on Immunization, to the Ministry of Health through the National Immunization Program, and through development of training guidelines and tools. I encourage all partners and stakeholders to continue to work together to reach our objectives by focusing on the following key areas. First, to ensure that all girls eligible receive the vaccines whether in school or out of school. Second, to integrate the communication on HPV vaccination into the broader services and communications. Third, to continue to support Ministry of Health to successfully introduce HPV vaccines in the routine services of the National Immunization Program and achieve high equitable coverages. I would like to congratulate the government of Nepal for this excellent initiative. Your actions will improve the health and the lives of women and girls throughout your beautiful country for many years to come. As the WHO, we are extremely pleased and proud to be a part of this journey, and we wish you a very successful HPV vaccine launch.